Hi everyone, it's Dr. Uze again, the Women Doctor Online. First off, I want to say a huge thank you to all of you that supported me on this channel for my last video on ovulation with your likes, subscription and comments. Your continued support and engagement will be needed in realizing my vision of improving maternal healthcare, especially here in my continent, Africa, that contributes to about 70% of global maternal death. I want to also use this opportunity to inform you that despite the 40% decline that we have seen in maternal health in the past 23 years, from 727 maternal deaths to 424 deaths, reports from the World Health Organization shows that the continent needs to increase the annual decline rate about 12-fold for it to hit the Sustainable Development Goals target of a fewer than 70 maternal deaths, 1,000 births by 2030. You and I can contribute to drastically reducing these numbers by sharing credible, relevant, current and up-to-date information as we do in this channel regarding maternal health. It is on that note that today we will be discussing one of the rising topics on maternal health, which is C-section. According to a new research from the World Health Organization, caesarean section is rising globally from 7% in 1990 to 21% today. Do you know what that means? It means that in every 5 live births, one of it is caesarean section, and it has been projected to constitute about 29% by 2030, which will mean that in every 3 deliveries, one of it will be through caesarean section. But the big question here is, why are these numbers rising? Without wasting any of your time, research has shown that these numbers are driven by 3 mechanical vehicles. One is lack of full information about caesarean section, especially around the risks and harmful effects of caesarean section. Secondly, disinformation by health professionals and health facilities to leverage on the profitability margin of caesarean section against normal vaginal delivery. And thirdly, it is associated to the fear and pain factor of normal vaginal delivery. With that information on the table, we could dive fully into the main topic of today in this channel. And if you stick with me till the end of this video, you will understand what caesarean section is, what are the types of caesarean section, what medical condition qualifies you for a caesarean section, and what are the benefits and harmful effects of caesarean section. Let's dive in. So what is caesarean section? In simple terms, it is a surgical procedure used to deliver a baby by cutting through the mother's lower abdomen to reach the uterus. It is usually performed when normal vaginal delivery is considered unsafe for either the mother or the child or both of them. Earlier in the video, I mentioned that caesarean section are of different types, and there are 2 major types of caesarean section, which the first type could be an elective caesarean section, which is planned with the mother in advance of labor. This is usually scheduled after 39 weeks of pregnancy. Or emergency caesarean section, which is performed during labor due to an unforeseen circumstances that might arise during labor. And this is the reason why you need to start your antenatal visit early and never miss an antenatal visit. Although you people don't know how to miss getting pregnant, but you know how to miss an antenatal visit, right? Anyways, there are different medical conditions that will place you either on the elective caesarean section or the emergency caesarean section, and I will be discussing it in just a minute. Let's begin with the medical condition that qualifies you for an elective caesarean section. One, which is CephaloPelvic Disproportion. This just simply means the pelvic lack of capacity to accommodate or allow the fetus to pass freely through the birth canal during delivery, and this is majorly due to 2 reasons. One, which is macrosomia, which simply means a big baby or the child's birth weight of greater than or equals to 4 kilograms. This type of babies are common in mothers that go on to develop gestational diabetics. And the second reason could be due to the type of pelvis that the mother has. There are 4 major types of pelvis that are there. One is the gynecoid, secondly the android, thirdly the anthropoid, and fourthly the platyploid. Among all of this, the gynecoid is the most favorable pelvis for normal vaginal delivery, as the remaining 3 others pose difficulties during normal vaginal delivery. In such cases, the mothers might be scheduled for an elective caesarean section. The second medical condition that could qualify you for an elective caesarean section is multiple gestation or multiple pregnancy. Although research has shown that mothers with twins are able to deliver through normal vaginal delivery. But contrary to that, pregnant mothers with triplets, quadruplets qualifies for an elective caesarean section. This is largely due to the child's position lie in multiple pregnancy, which comes with a lot of discomfort and makes normal vaginal delivery difficult. The stat circumstances that could qualify you for an elective caesarean section is previous caesarean section. Although research has shown that it's possible to have a normal vaginal delivery after you've once had a caesarean section.
Oh, wow.
But this option is not open for everyone and will depend on two features. One is a type of incision made during the caesarean section, and secondly, the duration between the previous caesarean section. If you stick with me until the end of this video, I will expand on this on the section of the risk of caesarean section. The fourth condition that could qualify you for an elective caesarean section is placenta previa, which is a complication of pregnancy whereby the placenta is covering the cervix, an important and vital part of the female reproductive organ connecting the uterus and the vagina. This covering could actually be marginal, whereby the placenta is abnormally close to the cervix but it's not covering it, or it could be partial, whereby it is covering part of the cervix but not completely, or it could be complete placenta previa, whereby the placenta is actually covering the cervical opening. One of the early signs and indicator of placenta previa is actually a bright red painless vaginal bleeding that occur around 32 weeks of gestation. Statistics have shown that about 51.6% of pregnant women complain about such bleeding before delivery. So it's very, very important that you take note and be vigilant about such bleeding. And if you come in contact with that, kindly visit the nearby clinic or hospital for a medical checkup. The final conditions that I would like to discuss in this video that will qualify you for an elective caesarean section is what we call the breech or transverse presentation. Normally, within 30 to 34 weeks of pregnancy, your child will present in a position known as the cephalic position, which is an upside down position, whereby the position of the child is turned upside down and the head is close to the cervix. Contrary to this, some pregnant mothers might present to the antenatal visit or the clinic with a breech presentation, whereby the child is not in the normal cephalic position that I've explained earlier, whereby the child is lying longitudinally with either the buttocks or the feet are closest to the cervix instead of the head, and this will pose difficulty in normal delivery. Thereby, such mothers are actually scheduled for an elective caesarean section. Now, you know the conditions that might qualify you medically for an elective caesarean section. What about the emergency caesarean section, which a lot of people have questioned with? Uzi, she wasn't scheduled for caesarean section, but my wife ended up giving birth to caesarean section. How is that possible? This is what I will be breaking it down in a minute. One of the reasons, and the most common reason, is prolonged labor. It constitutes about 25 to 55% of the reason for an emergency caesarean section, and it is a situation whereby labor is not advancing as expected, and this could happen during the first or second stage of labor. I will be releasing a full videos about the stages of labor. So if you have not yet subscribed to this channel, now I think is the best time for you to subscribe and hit the bell notification so that you don't miss my subsequent videos. A normal labor for those delivering their first child could last from 12 to 24 hours. And for those that are delivering their subsequent babies, it could last from 8 to 10 hours. So a labor could be termed prolonged or not progressing if it lasts 25 hours or more for those delivering their first baby and 20 hours for those delivering their subsequent babies. This could put both the mom and the child at risk. For the mom, it could predispose her to infection, severe bleeding after birth, and urinary incontinence in the future. As for the child, it could predispose the child to also infection, fetal distress, whereby we see the heart rate of the child decreasing as an indicator, and asphyxia, which is a state of suffocation due to lack of oxygen. The second circumstances that could qualify these mothers for an emergency caesarean section is umbilical cord compression. This is a situation that occurs when the umbilical cord that supplies oxygen and nutrients to the baby is squeezed or compressed, thereby restricting blood flow. One of the quick indicators for an umbilical cord compression is a decrease in fetal heart rate and a decrease in fetal movement. And one of the causes of this umbilical cord compression includes situation whereby the umbilical cord is wrapped around either the neck, arm, or body of the baby, or the umbilical cord exiting the birth canal before the baby. The third condition that could qualify you for an emergency cesarean section is umbilical cord prolapse. This is a complication that develops after the rupture of membrane, whereby the umbilical cord comes out of the cervix of the woman before the baby is out.
In this situation, the baby's head is not engaged in the pelvis. If the mom then has a rupture of membranes, it leaves an opportunity for that umbilical cord to fall through and deliver before the head. This is an emergency situation. Once this happens, any part of that baby, whether it be the head, the shoulder, the body, will start to occlude the umbilical cord and cut off the oxygen source to the baby. The baby quickly develops hypoxia and eventually will develop hypoxic ischemic encephalopathy.
The risk factors for umbilical cord prolapse include abnormal position of the baby, too much amniotic fluid, multiple pregnancies, and premature baby. Now that we have covered some of the medical conditions that lead to cesarean section, let's look at some of the benefits of cesarean section. We have seen clearly that when medically necessary, cesarean section is a life-saving procedure for both the mother and the child. And some of its benefits include reduced birth injury to the child. Secondly, it lowers the risk of pelvic or vaginal injury to the mother. And thirdly, cesarean section outcomes are fairly predictable, as it is a planned procedure when compared to vaginal delivery, whereby the outcomes are not predictable. As promised, we shall be completing our discussion on this video regarding cesarean section with its dangers and risk. One of the risks and dangers of cesarean section is uterine rupture. Remember when I made mention that what could qualify you for an elective caesarean section is previous caesarean section. Before attempting vaginal birth after caesarean section, it is important to note that the scar on the uterus from the previous caesarean section might be a point of weakness, and the immense pressure of labor contraction during normal vaginal delivery can cause the C-section scar to tear open, which can lead to severe internal bleeding, cut off oxygen supply to the unborn child, and increasing the chances of infant mortality and morbidity. The second dangers of cesarean section is chronic pain and adhesions. A significant amount of mothers reported long-term pain at incision site or deeper to the pelvis. The long-term healing process of cesarean section has been normalized and dismissed, but during cesarean section, internal tissues are actually cut. As the body is trying to recover or heal from such cuts, it can form dense fibrous bands of scar tissues called adhesion, and this adhesion could be a source of chronic pain as well as a potential site for future surgical complications. The third dangers of cesarean section is the foundation for future disease for the child through compromised microbiome. The microbiome are a complex ecosystem of bacteria that plays a critical role in immune system development that helps your child to fight infections. During normal vaginal delivery, a baby is coated in the mother's vaginal microbes through a process known as bacterial seeding. This process is crucial in establishing a healthy digestive tract microbe in the infant, which help your child to fight infections. C-section deprives this child the chance of developing immunity early in life, exposing this child to allergy-related conditions. Alright, that brought us to the end of this video. So hopefully you found this video useful and you now understand that the decision to undergo a cesarean section is not as easy as it seems to be. If you like this video, consider giving it a thumbs up, and if you got any question at any point in time about what we have discussed, consider dropping a comment below and I will get back to you as soon as I can. And if you have not yet subscribed to the channel, you could consider doing so, because we have more videos coming up about different vaginal discharge and what they mean, the physiological changes of pregnancy and stages of labor, and what to expect before going into the labor room, all in the coming weeks, and you will not want to miss out. And finally, stay healthy and stay informed.